Namaste, doctor. In our Ashtanga protocol, we give prime importance for ahara. And what happens if the patient who comes here for the treatment, their bystanders are not following our diet?
Yeah, in our treatment protocol, food is the first thing. But most of the parents can't implement that in the home because very difficult to implement a new protocol in the home because after some time our emotions will start work and we will give whatever they like. To overcome that only they are staying here for 21 days. But what I say usually is even during the stay over here, we will not give tea, no coffee, even for bystanders, the same food. The first intention of doing that is we also should give some support for the kid to maintain the diet. Otherwise, we will be like a motivator. We will say, don't eat that, don't eat this. For you, this is the food. That is not a favor thing. So, first of all, whatever we are insisting our kids to do, first we should do it. Otherwise, there is no what we say, it's not a good practice that we should follow. So, for a support, it should be done. Second thing, if we are also following it, kids automatically will follow. So, what I feel maybe some rare 5 to 10 percentage of the parents, they will mask what they do, in the sense they will keep some of the dates or even what we say cashews, badam, all those things they will keep it in the room, so that they think that if kid is not taking the breakfast I can give. Again the same thing is happening, ultimately they are cheating the doctor, ultimately at the end they are cheating their kid itself. So they can't expect any change, because giving tea or coffee or whatever the things idli dosa making is not a much big thing for hospital as such, as we are preparing 21 variety of food in a week. It's easy for our canteen or our canteen staff to prepare idli and dosa every day, but for some intention we are doing that. So if they are not following it in the proper way what we said, and they mask some practices, not saying to the doctor to whom we are doing this, for what purpose we are doing this. So ultimate purpose is to make the kid whatever they doesn't like, to accept whatever they doesn't like. Second intention is we should train them to restrict what they like. These are the two intention. So again if they are doing these mischief things, there is nil percentage of progress they can expect in after the treatment. It's not only that medicine over here is helping, even the practices also it's helping much. So my kind advice for that kind of parents, like they don't say it to the doctor keeping some banana inside the room and giving it if they are not taking any breakfast, such things it's not a trustworthy thing. They better get discharged and be happy with their present happiness, because we are working for a long term happiness. In between that, if they work for a short term happiness, like today let us give that, tomorrow I will be better, they can't. So in that case my humble request for those parents are, better skip all these restrictions and be without any restrictions, give whatever the kid like. That is ultimately they will be happy, no? But we can't expect a long term happiness, because to to positive should happen means we should have a struggle in the present day, then only we can expect a positive in the long term. Namaste.